We are at a wonderful moment in time when patient data are available because of the digital connectivity, because of the level of data that we can capture. The only downside is that these data are not being used at the moment in a more systematic way.
AllCan is an international not-for-profit organization focused on improving inefficiencies in cancer care from what matters to patients. The work that AllCan International is doing will demonstrate how data can be used effectively to improve cancer care in the problem areas identified by patients.
Cancer is a highly evidenced area of medicine. There's a huge amount of research that goes into cancer. It's also a really complex disease. Cancer is different for everybody, and therefore ensuring that we have cancer data that is relevant to that particular individual, their personalisation of their treatment and the assessment of the efficacy of that treatment is really important.
We often do collect a lot of data, but that can be over many, many systems, and these systems often, more often than not, don't actually talk to each other. Unless you can get all the bits of data that are important along the patient journey and marry those together, we don't have a lot of hope of really improving outcomes for our patients.
We advocate for full transparency of all the data, not only available to researchers, but also to the patient community and other stakeholders. Without data, we're traveling blind. As long as hospitals are not transparent about the mortality and the survival data, this is very bad for patients, because it means that patients are channeled to hospitals where they are not being treated as it should be. It's known by the authorities, it's known by the hospitals themselves, and still it is happening. We are wasting life and we are wasting money by not applying best practices.
I think that the clinicians, hospital administrators, insurers, patients, we all have the same aim, that we want to get the best quality data so we can get the best possible outcomes for our cancer patients. Of course, the devil is in the detail, so it's working out how we can do that and working out solutions all the way from getting everybody on board to having enough resources to do it, having the IT solutions to do it. But I think if you have the will, there is the way, and that's really what we want to start to show with AllCan.